Hello, I'm Dr. Bhavesh Popat. I'm an endovascular and interventional radiologist, basically a vascular specialist. I've been associated with S L Raheja Hospital since last 3 to 4 years. We've been doing a lot of exclusive varicose veins as well as diabetic foot related work as a team since last few years. Unfortunately, we all have been facing this pandemic since last few months. This pandemic has affected all of us, apart from being physically, mentally, all of us being locked down for a few months, and I'm hoping and praying that all of you are doing well, the families are doing well. But life must go on, healthcare must go on. At S L Raheja, since last few months, we all have been able to segregate completely COVID work from non-COVID work. I, like you, are worried. I, as a doctor, was also worried. Fortunately, the management has taken good care. They've provided a separate entry, they've provided separate floors for admission, separate staff, separate corridors, separate lifts. In fact, I'm comfortably doing my OPDs also here, wherein entire section is given a separate entrance and everything for non-COVID work. So we all have been segregating COVID work and non-COVID work and doing good work here at Raheja since last few months. I would want to highlight a couple of things about the specialty that I work. Basically, diabetic foot is one place where I have a huge role to play, and at Raheja we have a very big team working on diabetic foot. As you all know, with diabetes being one of the biggest and the difficult disease, the silent killer that we all typically know it as, affecting most parts of the body. We are the world capital of diabetes. Unfortunately, with diabetes, how you have vascular blockages, heart blockages happening in heart. Likewise, the blockages do come in the leg arteries as well, because the diabetes is a universal disease affecting the entire, each and every organ of the body. When that happens, and if you get some injury, or while cutting some nail, or while cleaning, you get injury, the wound tends to not heal for a long time. Sometimes people get gangrene as well. We have a very huge team here working on diabetic foot. The team includes a good set of nephrologists, a good diabetologist, myself a vascular specialist, and then a diabetic foot surgical team. Basically what we do is we do certain angioplasties as well as angiographies required to improve the blood flow in these foot areas where the wound is not healing. And once we've done, the foot surgical team as well as the foot rehabilitation team is there, which works on the treatment of these ulcers. Basically the intent being that we could salvage the leg as much as possible, and this we've been doing since years. Fortunately, we've been able to conduct these work since last few months, even in the COVID era as well, and hopefully we'll be able to provide a fantastic service despite COVID being around for next couple of years in and around us. Hopefully we'll be able to continue our work as well like that. Apart from that, varicose veins is one place where I have a huge role to play, and we all know people who stand for long hours typically end up getting varicose veins. Me as doctors am more predisposed to varicose veins. So the treatment includes multiple aspects. First and most important is to diagnose the patients correctly, whether they need the treatment, because not diagnosing every varicose veins would need a surgical treatment or a laser or a vena seal treatment. Some can be managed just with conservative management by just simple stockings or simple medications. So once we've evaluated them, the two best options for treatment now are the laser as well as the vena seal, the glue treatment. We are offering both these treatments here at Raheja since last few years. Completely painless procedure, no stitches, no cuts. Practically the patient is walking in next 2 to 3 hours. It can become a walk-in, walk-out daycare procedure. Thank you.